So thank you for
Great.
joining us today. My name is Janik Goryev, and I'm the Health Information Specialist with Brain Tumor Foundation of Canada. Today marks our 4th webinar of our 12-month series, and we have Louise Handy joining us from Ottawa, Ontario. Louise Handy is the Project Director for Advanced Care Planning in Canada and for the Speak Up, Start the Conversation about End-of-Life Care program with the Canadian Hospice Palliative Care Association, also known as CHPCA. She has also been the project manager for the O Canada project for the Canadian Partnership Against Cancer. Louise also managed the Educating Future Physicians in Palliative and End-of-Life Care project for the Association of Faculties of Medicine of Canada and the CHPCA. She's a registered nurse with broad clinical experience. So I welcome you, Louise, and thank you for joining us today, and I will hand it over to you.
Great. Thanks very much, Nick. It's a real pleasure to be here with everybody this afternoon, and I look forward to having a conversation with you about advanced care planning. Sorry, my slides aren't progressing here.
No problem.
For some reason they were when we tested. Oh, there we go. So I'd like to start actually by asking you a couple of questions, and Janique will put this on the poll for you. Have you ever heard of advanced care planning, and do you have a plan?
All right, so we've got the first question up. Have you heard of advanced care planning? Yes, no, or don't know? And we'll give you just one more second, everybody. Great. And it looks like 71% have, yes, heard of advanced care planning, 21% have not, and 7% don't know. Great. Thanks for answering that. And the next question, do you have an advanced care plan? Yes, no, or I don't know. Give everybody a moment here. Great. And it looks like 30% have an advanced care plan, Louise, 63% do not, and 7% are unsure.
Great. Thank you very much.
You're welcome.
So that's very encouraging, actually. I'm glad to hear that, almost 3/4 of you have heard of advanced care planning. And hopefully I'm going to be able to provide you today with some more information and some tips and tools to help you to do advanced care planning yourself, to do it with a family member, or if you're a professional to assist your patients and facilitate their engagement in advanced care planning. So I'd like to start by just sort of describing what we mean by advanced care planning so that we're all on the same page and we all have a similar understanding of what I'm speaking about as I go through the presentation this afternoon. So there's a number of important elements to advanced care planning, and one of the first and most important is that we think about our values. What's important to us? What kinds of things we value in life and hold dear? And stemming from that, what would our wishes be regarding our future health care? If we can think about situations that we might face in the future with regards to health care, treatment decisions, decisions about procedures, or decisions about personal care, what might our wishes be surrounding those future health care choices? And secondly, it's important when doing advanced care planning to learn about medical information that's relevant to our health concern. And this is different for everybody depending on where they are in their life, where they are in terms of what their diagnosis is, and where they are in terms of their illness progression and the prognosis of their illness, the benefits, the risks of the kinds of treatment and procedures that might be available to them. So in order to think about our wishes and to express them, we need to have a clear understanding of what those, what the options, medical and healthcare options might be. And then one of the key parts of advanced care planning is choosing a substitute decision maker and having conversation with that person as well as with other loved ones and our healthcare team. Now the substitute decision maker, and I'll talk more about that person later on in the presentation, but that's the person who would make decisions for us about our healthcare or personal care if we were unable to speak on our own behalf. So if we became incapacitated is the language that's commonly used. And that person is only turned to if we can't make our own decisions. So as long as we are able to make decisions, as long as we can speak on our own behalf, healthcare providers obviously turn to us. But the substitute decision maker is a key person if we can't make those decisions. And then advanced care planning can also include documenting our wishes and values in a number of different ways, and then sharing them with others. So today is actually a National Advanced Care Planning Day. Every day in Canada, or every year in Canada on April 16th, it's National Advanced Care Planning Day. So there's a lot of activities going around across the country in communities in order to engage people in advanced care planning and to educate them about it. So I'm really glad we've had the opportunity to have this conversation on this special day. So it's encouraging that 71% of you knew what advanced care planning is, because overall, when we did an Ipsos Reid poll in 2012, 86% of Canadian adults had never heard of advanced care planning. And on the other hand, 60% of Canadians thought it was important to talk about wishes for end-of-life care. So they may not have heard about the sort of formal process of advanced care planning, but more than half of them think it's important that they talk about their wishes. But less than half have actually done that, have actually had a conversation about their wishes with a loved one or a health care provider. And actually, one of the polls we did found that about 40% said that they were creeped out by the conversation. And that really is a reflection of our comfort, I think, in Canadian society with talking about our wishes for end-of-life care and talking about death and dying. And I think that we see this quite commonly, you know, across the board, that people, it's not something we've talked about commonly in Canadian society. A lot of people don't have much experience caring for somebody as they approach the end of life. So it's something that people are not comfortable with. And that's one of the reasons why we're doing this work, and we launched the Speak Up campaign, which I'll tell you a bit more about later. So I'd like to spend a couple of minutes talking about why we should do advanced care planning, why we should have an advanced care plan. We all know that the decision making we need to make around health care, around our illnesses, can be very complex. And the research is indicating that it's easier to make decisions when we've thought about our values and our wishes ahead of time and shared them with other people. So really what we're seeing with advanced care planning is that by contemplating our values, by thinking about our wishes early on, either before we become ill or when we're diagnosed, it helps us get ready down the line if we do have to make complex decisions. And of course, it enables our substitute decision maker and other loved ones, it gives them the information they need so that if they're called upon to make decisions, they have something to base it on. And the research is really showing us that advanced care planning eases the burden on our loved ones because it helps them understand our wishes, and then they feel more confidently that they can speak on our behalf. It's not easy to make these decisions often. Most often, it's not easy to make these decisions. But if we've talked with our loved ones and our substitute decision maker about what's important to us, they have a frame of reference. They have a context upon which to make decisions. So the research is showing us some pretty specific things about advanced care planning. If we express our wishes in advance, they're more likely to be known and to be followed at the end of life, and that's very important. So that gives us a sense of confidence that we will remain in control of our health care for as long as possible. We also find that family members have less stress and anxiety because they know the person's wishes. So as I said before, it really lessens the burden on family members, and it really is a gift to our families to have these conversations. And oftentimes when we talk to patients and families, we talk about it in that context, that this is a gift that you can share with each other. We also find that a person who has done advanced care planning is more satisfied with their care, as well as their family members and their substitute decision maker. They have a better quality of life and a better quality of death. And a recent study showed that if patients and physicians had end-of-life conversations, they were associated with fewer intensive care admissions and life-sustaining procedures that patients actually did not want in the first place. And I'm just going to share a few quotes from with you. There's a big study going on in Canada right now called the ACCEPT study, and it's a prospective audit study in 12 centers across Canada that is looking at advanced care planning from the perspective of patients and families when they're admitted to hospital. And this is a quote from a family member who said, "I don't have enough information about his condition, about what to expect. I'm trying my best, but I don't have medical background, and I'm alone in all this decision making and feel overwhelmed." So this is a family member of a patient that's admitted to hospital, that's critically ill, and that's being called upon to make decisions. And so you can see that if there had been conversations beforehand, if the patient and family member had had the opportunity to educate themselves about their condition and the options available to them, perhaps this person would not have had these feelings. Here's another one. "I didn't expect him to die so soon. My husband resisted talking about dying, and after 40 years of marriage, I feel he let me down by not opening up. And I guess I let him down for not knowing how to talk about some of the things that I needed to discuss. It would have been nice closure if things had been different in the end. I can't get that time back." Now, this really shows the importance of initiating the conversation. And many times, patients and families tell us that they're waiting for their healthcare provider to raise the subject, to raise the topic. It's not an easy topic to raise, and oftentimes people look to professionals for that. And here's another important story. Belinda wrote a blog on our website, and I'll give you the URL later because she had a very important experience and has shared it with us. She says, "Death happens when you're older, right? Wrong. Almost 3 years ago, my 20-year-old friend was diagnosed with cancer. She passed away this past fall. For me and my other friends, this was a shock. It never crossed my mind that this was a potential outcome." So one of the goals we have in promoting and facilitating advanced care planning is that people at all ages will think about their wishes and talk about their wishes while they're healthy, if they're diagnosed with an illness, with their family and friends, so that people will have the opportunity to learn what they want. So therefore, who needs a plan? Everyone. We never know when we'll face an unexpected event or illness and be unable to make our preferences known. And we all hope we'll be able to communicate right up to the end of our lives, but many deaths do not occur that way. So I'd like to get started and walk through the steps of advanced care planning, just to give you some tips and hints about how it can all work and what you can do. So the 6 steps that we've identified are: think about what's right for you, learn about your options, choose your substitute decision maker, have the conversation, write it down or record it if you wish, and then review your plan regularly. This isn't one conversation. This is a series of conversations throughout our life, throughout our illness as it progresses, because situations change. So let's start with the whole idea about thinking about our values and beliefs, and what do we mean by that? So if we think about what we value in terms of our physical and mental health, What are those things? Do we value being able to live independently, making our own choices, having a good meal, being able to talk to the people we care about, communicate with them, and having our privacy maintained? We need to think about what personal beliefs influence our healthcare wishes. Is it our religious beliefs, our spiritual beliefs? Certainly our past experiences with family and friends. And it's always a good idea to reflect on your experience with your family and friends as they journeyed perhaps through an illness, perhaps at the end of their life, and what kinds of decisions had to be made. How did that feel? Was there preparation in advance? And what was the outcome? And then thinking about things, if we're thinking about end of life, what would we like that to look at? Would we prefer to die at home? Would we rather be in a hospice, in a hospital? What might change our minds about that? Who would we want around us at the time of our death? And then in certain situations, we can think about medical interventions. Now these discussions and conversations are best had with healthcare providers along with family members, specifically to the situation that you find yourself in. So it is very much specific to what our disease is, what the prognosis of our disease is, and where it's likely to take us. So would we want or not want certain interventions such as resuscitation, feeding tubes? Would we want to be in an intensive care unit if we're unlikely to live independently? And why would I want or not want those procedures? You know, oftentimes people say, well, it's really hard for me to know specifically what I would want. It would depend on the situation, and that's absolutely true. But if we can frame this in terms of what we value, in terms of privacy, independence, relationships, communication, that helps our substitute decision maker make better decisions in the context in the future. Do we have fears about dying, about pain, about being unable to breathe? And who can we talk to about those fears? And then what would be meaningful at the time of my death? Who is it important for me to be near to? What do I want my environment to be like? What kind of spiritual support would I need? So the next step is learning about our medical condition. So that really involves talking to our doctors, healthcare providers about your medical condition, about the prognosis, what's likely to happen in the future. Obviously, healthcare providers can't almost never give definitive answers, but they can talk about possibilities, what you might expect, what different future scenarios might look like. What kinds of treatments can you have, and what can you expect to them, so that you can better understand. And then most importantly, have the conversations with family, friends, substitute decision maker, healthcare team. It can be, usually is, very, very awkward, but that doesn't mean that it's not important. So now, Janik, I have another poll question. Have you had a discussion with a family member or friend about healthcare treatments if you or they were ill and unable to communicate?
Great. Thanks, Louise. I just launched that for everybody. Give everyone a second to do that. And it looks like 80% yes have had discussions and 20% have not.
Fantastic. That's great news. Overall in the population, less than half of people have had these conversations, and only 9% have spoken with a healthcare provider. So it's very encouraging to hear that the group on the phone today has had the conversation. So then who do we talk to, and when do we talk to them, and where? You know, our partners, our spouses, our children, mom, dad, friends, doctor, spiritual leader. We always talk about having conversations when, you know, in a number of different scenarios that lend themselves to talking to family and friends. So a holiday, we always do a campaign around Thanksgiving in Canada. When families are together, it's a good time to have the conversation. At Sunday dinner, before I go on a vacation, before my kid goes to college, before I get sick, certainly if that's possible, but at the time of diagnosis, it's critical. Before significant life events like the arrival of a new baby. And where's a good place, a good time to talk? Some people say at the kitchen table, or if they go to a cottage, at the cottage, or in a restaurant, or on a drive. You know, it's often people find that they can have conversations, particularly with their kids, when they're driving, because they don't have to make eye contact, and it maybe makes it a little easier and a little less uncomfortable when we're walking in my place of worship. And then it's important to think about what are the important things that you want to be sure to say. We've come up with a few conversation starters that were developed actually through the Conversation Project, which is an American project similar to ours. And they really frame the conversation in a way that makes it easier to start. So I need your help with something because we do need help from our substitute decision maker, from our family and friends. It's always good to relate it back to another experience that we've all had. Remember how someone in the family died. Was it a good death or a hard death? How will yours be different? I was thinking about what happened to Mom, Dad, Grandma, Grandpa, and it made me realize, even though I'm feeling okay right now, I'm worried that things are going to change in the future. And I want to be prepared. I want to think about my future. Will you help me? I always think about my own personal experience because my mom died of cancer, and her and I had lots of conversations about her values and her wishes before she was diagnosed, certainly. But once she was diagnosed, she gave me the gift of talking to me a lot about what it is that was important to her and what life goals she had achieved and felt good about, and therefore at what point she would feel comfortable with dying. And that started really early in her illness trajectory, and then as she got more ill and moved through, you know, throughout her life towards her death, we talked about things more specifically, what she wanted, what she didn't want. You know, we were quite privileged that she was able to have palliative care, and so that was really very supportive for myself and my dad and my sister. And, you know, my mom died 20 years ago now. I miss her most days because we were close. But I have a very peaceful feeling about her life and her death because I knew what she wanted, and I knew that she had what she wanted. So when it came time for me to have the conversation with my daughters who are young adults, I knew they wouldn't want to have the conversation with me because I knew that, you know, as I felt at their age, they don't want to think about the fact that I'm going to die and that their dad's going to die. But I related it back. They were younger children when my mom died, but they remember her well. They had a close relationship with her, and they also remember my journey. So I started the conversation, remember when Grandma died and how hard it was for me, but how, you know, how good I felt and have felt since her death about the kind of death she had and how I was able to help her with that. And so that got the conversation going and has kept the conversation going for us. Now the next step is choosing a substitute decision maker. Now it's really important that you have somebody that can speak on your behalf if you can't speak for yourself. And depending on the province or territory you live in, the way you legally appoint that person depends on the legislation in your province or territory. And what that person is called is different in every province and territory. That's why we use the word substitute decision maker. Most provinces and territories have a hierarchy set out in their law so that if you couldn't speak on your behalf, they'd turn to the first person on the list. And that's most often starts with the spouse and then the children, parents, that kind of thing. But if you didn't want the person at the top of the list, let's say in my case, my husband would be at the top of the list in my, under the law where I live. And if I didn't want him to speak on my behalf, then I would fill out a legal document to specify perhaps that I want my sister to speak on my behalf. So it's important to check out what the situation is in your province or territory, and I'll show you a link on our website where you can do that later. So this is the person who will make medical decisions on your behalf if you're unable to communicate your wishes because of your illness or because of an injury, and they will give or refuse consent to treatment proposed by a healthcare professional, and so they advocate for you. They're your advocate for your care. So when you're thinking about who that person is, you need to ask some pretty important questions. Do you trust them to make decisions based on your values and beliefs? And that's why it's important to have the conversation with that person, because when it comes time to making decisions, they're asked to make decisions in your best interests and on your behalf and not in their best interests. And so it's really important that you and they feel confident about doing that. Can they communicate clearly? Would they be able to make difficult decisions in stressful situations? And are they willing and available to do that if the need arose? And again, the legislation specifies certain parameters around this person. They have to be of, a certain age, they have to consent, that kind of thing. And then finally, you can document your wishes, and you can do that. You can just write down your wishes, your values, your thoughts, anywhere. Some provinces and territories, again, have specific legal documents. Sometimes they're called medical directives. Sometimes they're called advance directives. That depends on where you live. But certainly it's a good idea for everybody to write down their wishes and share it with their substitute decision maker, so that they can see what you're thinking. And then if you have documents that you've written, it's important that they be with you if you're admitted to hospital or somewhere else. And again, as I said, this is not one conversation. We need to review it when our health status changes, when we change our treatment provider, our location, when our life changes, and in any case, every year. So now I'd like to talk to you a little bit about Speak Up, Start the Conversation about End-of-Life Care, which is a national campaign for advanced care planning in Canada. And I'd like to just point out a few tools that are available to you to help you do advanced care planning with on your own, or your own advanced care plan with family members, or with healthcare professionals. So we have a website, www.advancedcareplanning.ca, and there's tools there for patients, families, and for professionals. So for patients and families, we have a workbook that takes us through those steps I talked about, thinking about values and beliefs, learning about medical procedures, writing about our preferences, sharing with our substitute decision maker and others. And this is an interactive workbook that you can download. If you want to print it out, you can. You can fill it out on your computer if you want, and then share it with other people. We have one workbook that's sort of applicable across the country, and then we have an Ontario-specific workbook that has very specific information in it about the Ontario law. And if you check in your own province and territory, there might be other resources that are specific there. We also have a wallet card where you can write down the contact name and then the name and contact information of your substitute decision maker and carry it with you. When you go to our website, you can check out other resources in your province and territory by clicking on that link under the quick links. And remember, I mentioned that things like how you legally designate a substitute decision maker and whether there's such a thing as a medical directive in your province or territory. You'll find all of that if you click on those resources. We have a very specific resource if you or your loved one has been diagnosed with cancer, and it's a tool, especially for someone diagnosed with cancer, to reflect on values and wishes, and it provides some very useful questions and information specific to a cancer diagnosis. And then we have a number of resources for professionals. One important one, one of the ACCEPT study that I talked to you found that less than about a quarter of the those people that were admitted to hospital who were very ill were asked when they were admitted if they'd done ever any advanced care planning. So we just developed this Just Ask conversation card for professionals that has some conversation starters for them, questions that they can ask their patients, and then questions that they need to ask themselves about whether or not they've engaged in advanced care planning. We also have a primary care toolkit. Now this is a toolkit that nurse practitioners, physicians, social workers, other healthcare providers who work in a primary care environment, be that a private practice, a family health team, or a community health center, or a clinic, a cancer clinic, a hospital or a community-based clinic, they can use these tools to help engage their patients in advanced care planning. So there's posters they can put up, there's information sheets for their patients, and information sheets for providers. And we also have a tool for cancer professionals. So this is a companion tool to the one I talked about for patients and families, and it is for oncologists, for oncology nurses, oncology social workers, spiritual care workers, and it explains the importance of starting conversations early at the time of diagnosis, and again provides tips and useful conversation starters. So in summary, I'd like to say that advanced care planning is about conversations, it's about decisions, and it's how we care for each other. And I'm happy to answer any questions that you have, and I'd love to hear from you. Thank you very much.
Thank you so much, Louise. What a useful and great presentation. Lots of really great information, a lot of really great general information about advanced care planning. And as Louise mentioned, please do check out their website, the Speak Up website, as that particular section or the quick links does have information by territory and by province. And so you can look up specific resources within your province and territory. We have two questions that have come up, Louise.
Yes.
One is advanced care planning the same as living will, or is it the decisions made for the palliative patient?
Okay, so advanced care planning is actually not the same as what we've known the term living will to be. I'd like to say, first of all, that a living will is not a legal document in Canada. It has no legal status in any jurisdiction. And living wills were historically thought of as something where, you know, you wrote down what you wanted to happen if you were dying, or if you were in a coma, or in a situation where you were, you know, your life was threatened and there was little chance of recovery. So living wills often had things in them, or have things in them about, you know, I don't want resuscitation, I don't want a feeding tube, I do want a feeding tube, I want to go to ICU, that kind of thing. Part of the problem that people ran into with living wills, or run into with living wills, is what I spoke about earlier, that they're not specific to the context that the person finds themselves in. You know, I could say right now that I don't want to go to an ICU, but if I got hit by a car and, you know, there was a chance that some time in an ICU could bring me back to a quality of life that I would want to enjoy, that decision would obviously change. And these documents, in a number of, or in some provinces, a written document isn't what the healthcare provider turns to. They turn to the substitute decision makers. So, for example, in Ontario, the healthcare provider must turn to the substitute decision maker who gives consent to treatment or refuses. And the way that person is named legally, if it's not the person at the top of the hierarchy, is through a power of attorney for personal care. In other provinces, healthcare professionals can look at a medical directive that's been done by a patient, but it needs to be done specifically under the way the law dictates it to be done. So that's sort of what living wills have meant in the past. Advanced care planning is much broader than a living will, and it's based on two important things: thinking about values and wishes and talking about them, and making sure you have a substitute decision maker. Those are the two critical components of advanced care planning. Those are important in every province and territory, no matter where you live. They're supported under the law in every province and territory, no matter where you live. You know, as we've seen in the research, when people have these conversations, they're more ready to make decisions later on in their illness, at the end of life, when they get to that point, as are their substitute decision makers. So I hope that answers the question.
Great, thanks Louise. And just one other question that came up from the audience. Is it suggested to seek legal counsel when formulating my wishes, particularly if I wish healthcare professionals to cease life-sustaining efforts in specified end-of-life situations?
It's not necessary that everybody see a lawyer or have a lawyer draw up their documents. In most provinces and territories, you know, the government tells you very specifically how to do it, and you can do it as long as you have, you know, the right witnesses and signatures, etc. But if you've got some very specific wishes that you're concerned about and that you want, you know, your substitute decision maker to see quite clearly in legal terms, and you want healthcare providers to see it quite clearly in legal terms, then you would probably feel more comfortable seeing a lawyer. It's really important, of course, to talk to your healthcare professional about what the different options mean in terms of your illness, your prognosis, and your quality of life, because there's a couple of things we know. Some interventions may prolong life, but they may not in fact add to quality of life, and in some cases they may take away from quality of life. And the other thing we know is that in order to give consent for me to either have a treatment or not have an intervention or procedure, I need to understand it, I need to know what it is, and I need to appreciate it, which means I need to really understand and appreciate what this means in the context of my illness, what the risks are and what the benefits are. So before we can legally, or before we should legally commit ourselves or ask our substitute decision makers to commit themselves in the future to certain things, we need to understand what they mean for us. And again, if you go to the province and territory link in our website, in many cases we've linked to either the Justice or Attorney General Department in the province, or there's legal education organizations in many provinces who have taken the law and put it into simpler terminology. And that sometimes helps people to decide whether they want to see a lawyer. We're actually working, we work very, very closely with the Canadian Bar Association, and we're hoping to secure funds to develop a toolkit for lawyers about advanced care planning. We would start by doing that in Ontario, and then we would have it available to adapt in other jurisdictions. So that, not that we expect lawyers to have, you know, conversations about what the implications of resuscitation would mean in terms of my illness for me personally, but we think that they should be able to start the conversation, to encourage their clients to have the conversations, and to get, you know, direct them in the towards tools they can use to do that. We do see lawyers for, you know, for our wills, and many lawyers at that point do raise the issue of, you know, planning for future health care, and we're really encouraging them all to do that.
Great. Thanks so much, Louise. As I said, such great information, such great resources that the Speak Up campaign has. I really encourage everybody to go to the website and take some time to review the resources and the information. We also have some advanced care planning articles on our website at www.braintumor.ca. And we want to thank you, Louise, for taking time out of your schedule for being with us today. And so exciting that we had our Advanced Care Planning webinar on National Advanced Care Day here in Canada. So thank you very much, Louise.
Thank you. It's been a real pleasure.
Lovely. And so just to remind everybody, the webinar has been recorded and it will be up on our website in a week or so.